The National Cabinet agreed today the principles for Australia's COVID-19 management and reopening, importantly. So states are agreeing and territories to the following principles about prioritising the vaccine rollout, maintaining readiness to ensure suppression, so that goes to the COVID-safe behaviours, testing, tracing, etc. Ensuring that measures are proportionate in responding to outbreaks and are consistent, that are focused also on protecting national wellbeing that goes not just to health issues but the economic wellbeing of Australians. Clear and effective and coordinated communications with a focus on maintaining confidence. That the vaccination rollout should be proceeding as efficiently and quickly as possible, that jurisdictions should continue to improve their quarantine management. They agreed to adopt the AHPPC advice of easing venue restrictions to be no stricter than the 1 per 2 square metre rule. So that is a maximum now, a maximum. And I know that states have already moved to make it even less restrictive than that, and others will be doing so very soon. Agree to adopt the AHPPC advice that large ticketed and seated gatherings can have 100% capacity. That the AHPPC advice that the easing of restrictions can occur on the basis of international borders remaining substantively closed and a reduction in the risk of incursion through the vaccination of quarantine staff and their close contacts and healthcare workers. They agreed to prioritise local containment measures and aim for outbreak responses that keep internal borders open, was agreed today. And they further agreed to task the AHPPC with specific health advice regarding the implications for quarantine arrangements and reopening of Australia of a successful vaccine rollout for the most vulnerable Australians, that is phase 1A and 1B, and the current evidence around the effect of TGA-approved vaccines on transmissibility of COVID-19. What we're asking the medical expert panel to tell us is, what are the thresholds that we need to be able to meet to do things such as the following? Australians who are vaccinated being able to travel overseas and return to Australia and not go into hotel quarantine, potentially go into home quarantine or not even to home quarantine at all. That will be a major change. And the extent to which Australians returning from overseas who have had recognised vaccines, also approved here in Australia with appropriate accreditation, can return to Australia on that same basis, and to enable, potentially down the track, travel from low-risk countries with similar vaccine arrangements. Now, no one is saying that any of those things are coming in today, but what we are working and planning for and have tasked the medical professionals who advise us on is what are the marks we have to meet to enable us to start opening up Australia more than we are now. Now, we already have the New Zealand open arrangement. We welcome that and we look forward to the success of that in the coming months. That will give us a greater degree of confidence about when we can move to other countries. I've mentioned Singapore before as an obvious next choice, but at this stage that is still some time away. So the message from National Cabinet is we want to open up more, we want to do it safely, we want to ease restrictions, we want to do that in a consistent way across the country, and we want to do that because we know we're not just managing the health, but we're managing the economics as well for people's livelihoods and well-being. And this is going to be an ongoing and increasing focus of the National Cabinet. We noted the work that was being done in New Zealand, and we also note that, of course, at the end of the day, every state and territory is responsible for public health in their own jurisdiction. So they haven't offered up their sovereignty on those issues. That wasn't likely, but I do very much welcome their agreement to those principles today.